Have you thought about getting a smile makeover or implants placed, but you decided to travel to a different country to get it done because it's cheaper there? Welcome to this episode of the Wonder Tooth podcast. Please get the code DENT, DENT 63 to get a complimentary virtual consultation. If you are thinking about getting some dental work done, DENT 63. And make sure you follow, you like, and you share in the comments below your experience with this. My name is Dr. Saad, and I am a dentist practicing in New Jersey, and I have over 20 years of dental experience. I'm licensed actually in the United States as well as in Canada and in Egypt. I've done a lot of dentistry. I also hold a master's degree in implant surgery, like implant placement and implant restoration, and I am one of the top cosmetic dentists on the East Coast. I'm a celebrity dentist too, but anyway, yes, we do have some patients who come to the office and be like, I need a smile makeover, blah, blah, blah. My insurance doesn't cover this because it's cosmetic. It's not covered. You still get some sort of like the discounted contracted fee, I guess. But some patients, they decide we are going to travel because it's cheaper to do it in such country or such country. And actually, I don't mind, helping them with this. So I just want them to get some real good dental work done. So what would you do in this scenario? So in any scenario, you have to, especially if you're going to, let's say, your country of origin, or if you have friends there or family there, you have to make sure you are actually going to a very, very, very good dentist. And I think it's easy to, especially if you know somebody there. So don't just rely on social media, because and unfortunately I have to say this, because some of my work personally was taken and I've seen it put somewhere else, even though I put that, like I've done this, you put that little watermark, but it has been taken and it's been put somewhere else, and pretending that it is part of their work. Didn't happen just to me, but to other dentists as well that I personally know as well. So make sure, not just the social media, but also make sure you get reviews from real people that you know. Don't go like in the blind. Okay, they have like 500,000 followers on this or that, because that doesn't really mean anything, except for if you know somebody in person who got the work done there and they would recommend it to you. If it's hard, you have to really look at the credentials. You have to find out where that dentist got their training from. Are they fresh out of school? Do they have many years of dental experience? You have to read, about what they do and how they do it. But most importantly, you have to also know, if you're getting work done there, if let's say something happens, especially about implants, are these particular implants that they're gonna place in your mouth, are they used in the United States of America or in Canada or wherever you live? Because this is a big problem now. There are like over hundreds of dental implants, and I'm talking about the brands. Each implant is different than the other. Each implant has different restorative kit, which basically not just the surgical part, so they can put the implant in your mouth, then they can put the crown on it, and let's say it becomes loose, the crown becomes loose. Who's gonna tighten that for you? We need to know the type of implant to begin with. And if we don't use that type of implant in the United States because they are using some different off-brand, we don't know, then what you're gonna do? You have to get a ticket, travel there, get that tooth fixed, and then come back. So you really have to put all of that in order. And now that, the tickets are pretty expensive to fly. So you really have to think about that. If you are really willing to do that, embark on that adventure, make sure that the implants that they are going to use are actually being used in the United States of America. Maybe you can ask your dentist, what kind of implant system do you use? What kind of implants are you restoring? Because it's completely different. I've had patients who came to me with implants I've never seen before. And I'm like, I can't really help you. I don't know. And then they will contact the dentist there. The dentist will send me. I'm like, I've never heard of these. These are not even used. They're not sold in the US. I cannot get you the part. Like, we need a specific part, to tighten the implant or to maneuver with the implant, and every part is completely different. So you really have to do yourself a favor and make sure that this part is covered. then the credentials of the dentist, obviously it's covered. Now, let's say you want to go and get some cosmetic work done. This is a big one because there are different materials that are used. And I don't like to say, but I know a lot about the material that are being used in the mouth. So some of them are porcelain fused to metal. You don't know what the metal is going to be in it, especially if you get it done outside the country. If you get it done here, so at least we know the lab we are using. If you are going to get zirconia versus porcelain, and what kind of porcelain, and if it's done correctly or not. So cosmetic work can be beautiful and it can look fantastic, but you also need to make sure that the foundation underneath is really holding up. And not every time you are getting, and you have to really listen to this particular line, not every time you are getting cosmetic work, you have to get a root canal done. This is very important, guys, because it's been like, it's insane. So I've had a patient who came to me and he needed, I think, like a couple of crowns and 3 fillings. He told me, I'm traveling to my country. It's pretty expensive here. And I said, I understand that. Make sure you go to a really good dentist. I gave him the treatment plan. And I said, this is what you need. You need 3 fillings on these teeth. You need 2 crowns on these teeth with the teeth number in them. And I said, if they need anything, this is my email, my office email. They can contact me and I will happily, we give him the x-rays too. I will happily help. I understand. He went and he came back, 6 root canals. 6 root canals, 7 crowns, 2 implants. And I said, what is that? I was shocked. I was actually very upset. I treat the patients like my family. So I was very upset. I said, you didn't need a root canal. What is this? Why did they pull those teeth? He said, I just listened to them. And I said, but I told you what needed to be done. And he was like, he just didn't. I think I was more upset than the patient himself, because I'm like, you didn't, this is not needed at all. Like, you didn't need any of this. Anyway, and even the implants, when they placed it, it was going to the root of the other. It was just a mess. So usually the implant, when you place it, it has to go parallel to the other natural teeth. You have to have at least 3 millimeters away. So that's why when we do the measurement for implants, we have to select the size of the implant that is good enough to allow me to have 3 millimeters from each side of each root. Otherwise, this is going to compromise the vitality of the 2 teeth on the side. So of course they did a root canal on the natural tooth, then they went, so this is the natural tooth now, they went with the implant, like going like right into the root of the other one. And I said, I don't know what to tell you, but this is not, I'm not touching this. Unfortunately, I will not touch this, because this is becoming a little too complicated now to fix. And this is one part that you guys who are considering getting dental work done somewhere else, you really have to consider. It's the follow-up, it's the adjustment. A lot of people who travel, you go for like a couple of weeks, 2-3 weeks for a vacation, and I'm gonna get the dental work done, sure. But who's gonna follow up with you? What's gonna happen if this becomes loose, or if it falls out? Or who's gonna tighten it back to you? Because honestly, I am not gonna touch it. And I know a lot of other dentists are not going to touch it, because it becomes a liability at this point. It's not that we don't wanna help you guys, but it becomes a liability on us. So basically, that implant that's going sideways, if I try to adjust it or fix something, then okay, you touched it, you are responsible for it. So we don't wanna be responsible for work that we didn't do. Of course, we stand behind the work that we do all the time. Now, I had another patient, and she came to me like a month ago. She actually found me, I think, on YouTube or something. And she came to me, and not a word of mouth, like she doesn't know me. And I said, I want to have this relationship with you first before we get to this. So I brought her in, we did a consultation. So her big problem was she went out of the country, she got a big smile makeover, and I'm talking all the top teeth, all the bottom teeth. She's young, she's in her 30s, she's beautiful, she's got a gorgeous face, but she wanted the really pretty white teeth. So they did all of the top teeth, all the bottom teeth, very, very white, which I don't have a problem with the very white, but they did a root canal on every single tooth. Every single tooth. They went and they did a root canal on every single one, top teeth, bottom teeth. I'm talking, it was like around 25 teeth because she had a couple of missing ones. And that was not her problem. Her problem is her gums were gushing blood. And she came to me and I'm looking and her gums were so inflamed, so swollen, without even you touch the tooth, it starts to bleed. And she is in severe pain. She had bad breath and she couldn't clean between those teeth. And why is that? Because they made them all connected. You understand? So they crowned, first of all, in order to get a smile makeover, you don't need to be crowned. You guys understand what's the difference between a crown, 360. I'm going to go back to my previous episodes. Make sure you watch them. The difference between a dental crown, where we shave 360 degrees all around the tooth, versus a veneer. Veneer is mostly for cosmetic, and you just go very thin around the outside of the tooth, like less than 180 degrees, very thin, like 0.3 millimeter. They shaved all of her teeth, 360 degrees, all of them. They did root canal on all of them, top teeth, bottom teeth. And when I asked her, who did that? And she goes, it's a very famous cosmetic dentist. And I said, what do you mean famous? She was like, that dentist has like hundreds of thousands of followers in the country. And I'm like, oh my God. So they connected all of her teeth. So it's impossible for her and for me to actually go and clean. You cannot even go with the floss threader. Forget the actual floss, because you can't. They're all connected. But even the connection, they made it so high up. So we have something called the floss threader, which is a very thin plastic thing that you hook the floss in it. And usually we recommend this for people who have bridges. You go and you pass it and you go from the other side and you still can get the floss underneath. It's so high. Those connections are so high that you cannot even do this. So her gums are severely inflamed now. The bone of the jaw is now starting to kind of shrink away because there is bone loss, because you can't clean and stuff are getting stuck and bleeding is incredible. And I looked at her and I said, what do you expect me to do? And she's like, I am ready for anything because I am in severe pain. And I said, you do understand that this whole work is going to have to be replaced again? And she said, yes, I am very aware of this, but I am in so much pain that I need this to be fixed. That had to be done on stages now, because something like this, you cannot just, okay, let me remove this and put something else on a spot. I have to now stabilize her health, her oral health. So how did we do that? And that's basically what I'm telling you guys. Sometimes it sounds like it's cheap and, oh, it's beautiful. I can get like all my whole smile makeover done, like a fraction of the money that it's going to be. But you're going to get this whole thing redone all over again, plus the pain, plus the discomfort, plus you have to think about this. Anyway, so what we did to fix this, obviously, she needed a deep cleaning. Nobody could do a deep cleaning because they were so completely connected and it's impossible to actually go between the teeth. So what I ended up doing, we did the top teeth first. Obviously, cannot go top and bottom at the same time. But we ended up the top teeth. I ended up cutting all those crowns, all of them. And it was gushing blood. Like, I was like, oh my God, if somebody comes now, they will think I am killing those teeth. I mean, it was really bad. I ended up cutting these. We had to clean, and I had to put temporaries at this point, separate temporaries, like separate temporary crowns. And she had to get a deep cleaning. And then we had to wait for at least 6 weeks before I could even touch those teeth again. So brought her back in 6 weeks. We also gave her like a medicated mouthwash. It's a prescription mouthwash. And just to we needed to get the gums a little bit under control because it was insane. We got this under control until the gums started to be nice and pink again. Then after that, we removed those temporaries, cleaned again, and then I had to go with laser to kind of make sure to trough all those, basically the bad gum tissue, the granulation tissue, the bad disease tissue. Basically, we put another set of temporary crowns to make sure the gum now is okay and healing beautifully around those temporaries. Then eventually, we had to remove those temporaries, and then we finally put the permanent crowns. Separate, completely. Each tooth has a separate crown. I mean, she had crowns from before, so I cannot go back and put veneers, unfortunately. And a couple of her previously fixed root canals that she had done over there, I had to send her to the specialist because they were not done properly. So she had to get a retreatment done. So she paid a lot of money really for this, because also the specialist, it's a lot more money. So it was just it became very expensive, and it wasn't done properly. And I just felt so bad for her. So at least right now, her gums are under control. She can smile, she can function, and she doesn't have bad breath. So basically, the bottom line of this episode today is make sure, if you really are considering getting some work done, maybe talk to your dentist first. Maybe you guys can come up with some sort of a payment plan, something to kind of help you out in this transition. If you want like a smile makeover or implant, they can come up with something. You know, there are some credit cards that can be used or something. You know, you can prepay ahead of time, something. If you are 100% willing to take the chance and get this done somewhere else, then make sure you really consider who you are going to see. Make sure that they are using materials and stuff that are familiar here in the US. You can even ask your dentist about that. Even you can consult with your dentist when you are there. I mean, I'm pretty sure your dentist, I mean, I don't really care. I mean, we have a lot of patients already. So I'm just going to help, you know, as much as I can. But of course, the bigger issue is the aftercare. If something happens, your dentist is probably not gonna be involved in any of this at all. So are you willing to travel again back and forth to your dentist over there to get this fixed? And if it can be fixed on the same time, you know, your trip. I've had people who did it and they were like, it was a big mistake that I've done this. And I mean, it's already done. Like, you know, you can't really, I don't know what to say, but you cannot undo it. That's a problem. You cannot undo it. But I have seen few patients who actually got this work done somewhere else who came back to me and we had to redo the work. So just make sure you guys are thinking this over. If you need a consultation, if you are considering getting like a smile makeover or you are thinking about getting implants, we would love to help you. We can, as I said, we can help you with a virtual consultation. Just put the code in the comments, the Dent 63, and you can contact our office and we can take it from there. Meanwhile, make sure you subscribe, follow, and share this episode with your friends or your families, or whoever is thinking about getting teeth done. Don't forget, you know, if you take care of your teeth, and I mean take care of them really well, they will take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.